Great to see everybody here. My name is Anand Parekh. I'm the Chief Medical Advisor at the Bipartisan Policy Center. So I think the first question where we'd like the panel to start with, and maybe Patty Dale, we'll start with you and we'll just go right down the line, is I think it'd be great for the audience to better understand how you and your organization at Humana are making healthy aging a reality. So Patty Dale, can you start us off?
Absolutely. So folks may not realize that Humana actually started as a nursing home company 56 years ago. The founders looked around, and while their mothers were not safe to stay in their homes, they realized there was no good place to take their mothers. So we've been working at caring for seniors for a long, long time. And today we have about 3 million seniors that we care for. And 1 million of those are in a program we call Humana at Home. And that we started over a decade ago to help make sure that seniors could comfortably and safely age at home, because we believe that they do best when they're aging at home. The work that I get to do, the bold goal work, is work that says if we want to keep seniors at home, we have to be 24/7 for that senior, which means that we don't just care for them when they're in the physician's office. We have to think about what happens once they step out, on their way home and at home. So the work I get to do is to look at barriers to health, social determinants of health, and our focus is really around two that have popped to the top: food insecurity and social isolation and loneliness. And just from a personal perspective, I'll say that I'm very interested in both, but the social isolation and loneliness really hits a chord with me because I was blessed to have a grandmother who is what we think of as a super ager. She was the oldest living practicing chiropractor when she died at 104. Thank you, isn't that great? And I've tried to sit up straight. But 22 years later, just a year ago, I lost my mother at only 91. And when you've had a mother that was 104, 91 is too young. And I know now through the study that we've done at Humana, she had no physical illness. She really had no traditional mental illness, but she was profoundly lonely. And that took years off her life. So I'm really blessed and fortunate to be able to get into the study of that so that we allow people to do more of that super aging as opposed to not realizing that they're slowly seeping away from loneliness.
Thank you. Omar?
Yeah, so, some folks might be thinking Lyft, it's a rideshare company. What the hell does it have to do with healthcare or healthy aging? It actually has everything to do with it. So, if you think through, Anand had mentioned some statistics, and by 2020, in the world, folks over 60 will outnumber children under the age of 5. So you can just think what a shift that is. And then here in the U.S., if you look at seniors over 65 that do not drive, over half of them end up staying at home, and around 45% of them experience loneliness. Mm-hmm. Exactly. And so, if you think about the impact that has on medical appointments, upwards of 30% of missed medical appointments, the costs associated to that, the degradation of care associated to that, all of those impacts truly kind of made Lyft look at what we offer and our vision of improving people's lives with the best and the world's best transportation, aligning that with healthcare, with healthy aging, to bring a solution to the forefront that removes that technological barrier, removes that financial barrier, and positions a solution into our partners, whether they're health systems, elder mobility organizations like a Brookdale, even into health insurances like a Humana and United Healthcare, and positioning them as the means to provide that ability for those patients, those elders, to then reconnect with their families, reconnect with their friends, and ultimately reconnect with their communities as they look to improve their outcomes of care and continue to live that healthy lifestyle.
Mm-hmm. Great. Mayor?
Well, good morning, and I'm honored to be here with you all. I've been in office as the mayor for just under 2 years, and before that as vice mayor. And the city of Alexandria has about 150,000 people just south of DC, as many of you know. And we're a very blessed historic city. About 10% of our population are seniors. But of course, as you know, that will grow. And what's already been stated, I just want to echo that social isolation is so devastating. A friend of mine, Virginia Allen, the founder and longtime director of the Georgetown Senior Center, used to say, it's really about the plague of loneliness. And I agree with her. And so in Alexandria, and as the mayor, I know that I'm extremely focused on doing all that we can do in the city with regard to programs, regard to policy, and we'll talk about some of that. But we've had some long-standing nonprofits in the city. We also have a wonderful commission on aging. Now that's a city commission where you're appointed to serve on that commission and recommend policies, not just to us, but to the state legislature. And one of the first things I did as the new mayor was I convened a seniors advocacy roundtable. And I had the different stakeholders of these various groups sit down with me. So Senior Services of Alexandria, a wonderful nonprofit, also at Home in Alexandria, which is a village network, if you will. There's one in Georgetown. They're all over the country. There's some 300 across the country. The Commission on Aging had a representative or two. It goes on, and we sat there and figured out, what are we doing? What can we do better? Where are the links? What are you doing that the city could be doing with you? How can we, sometimes we inadvertently work in silos. And so I brought everyone to the table to say, how could we do this better together for the sake of our seniors? How can we create intergenerational friendships among the seniors? How can we tap into their wisdom? And how can we let them know that they matter and that they have a role to play in benefiting our city? And so there's so much. And we were just named the first age-friendly community in the Commonwealth of Virginia. I'm very proud of this. The first city to be named an age-friendly community, and this is connected, of course, to the World Health Organization and AARP. And we are just absolutely thrilled and honored, and we'll be pursuing that. Anyway, I want to yield to my colleagues here on the dais, or whatever, this table, not the dais, I'm used to the dais. But anyway, we'll get back to some more conversation about other things that we're doing to be extremely proactive and collaborative. And I think that's the key. And any city can do what we're doing. And I'm happy to share those ideas.
Great, thank you, Mayor. Frank?
So, hi everybody. I am a futurist, and I straddle the world of fascination and fear. If you spend the kind of time I do looking at what's coming. And really the phenomena of pace and the number of dots that are emerging that really need connecting in ways that allow us to see where this future is going is just fascinating. If you could pull up the slide that I have, just to give you a sense of what I mean by that. I use this visual, which really represents both. You have the slide? Yeah. Okay, it might be a little bit harder to see there, but this slide starts to talk about some of the convergence of the sciences and technology, a lot of things going on in the middle around society, and then a number of emerging scenarios that will really transform our world. And I spend a lot of time in each of these scenarios, but in the context of today, the healthy life extension scenario is the important one. And if you look at the visual, I know it's hard, I usually build this so it's not as overwhelming, but there's a number of dots that do connect to enable our healthy life extension. And there are a number of folks in the life sciences community that believe the first person to live to 200 has already been born. And the advances in the sciences and technologies and in computing capacity and energy, as those advances and more dots that connect occur, it enables more breakthroughs in terms of innovation and advances in sciences and technology. So, for example, just two things that were mentioned on stage here, the notion of isolation and being cared for in the home. As the smart home emerges and the sensors and artificial intelligence and machine learning actually can help us understand the patterns of the elderly in their home and understand when anomalies are occurring and then deal with those anomalies proactively, the smart home becomes a mechanism to enable healthy life extension and living in the home. And mobility as a service, and as autonomous cars take over in the next 15 years, then the elderly and the young and the disabled also get to be mobile. through technology and advances in those kinds of things. So the importance here is the PACE phenomena is creating an explosion in innovation that folks aren't comprehending yet. And I think the service to provide the connection of these dots is the most important mechanism in enabling some of the advances that I think will happen in the area of life extension.
Thanks, Frank. Catherine?
Good morning. Thank you for the opportunity to be here today. When I was introducing myself to the mayor, it was a great tee up for me. I said I was at United Healthcare and I was here to talk about the things we're doing in housing. And she said, United Healthcare and housing? I get that all the time. But the reality is that if you are in healthcare and you have financial responsibility for millions of lives, particularly elderly, disabled, and underprivileged individuals, you can't help but be in housing. Because at the end of the day, there's only so much that we can do from a healthcare perspective if we're not meeting the very basic needs of an individual. We can't possibly meet the growing demands for elders and disabled individuals who want to live independently in their communities, nor can we meet the reality of addressing some of the most complex healthcare needs that any generation has faced before them if we can't meet people's basic needs. And because of that realization, some of it's clearly and simply financial. Some of it is about how do we serve the communities in which our members live. And over the course of the last few years, United has I think, pretty boldly stepped into some pretty non-traditional investments in the communities that we serve. And that ranges, and we don't have to get into the minute details, but I'll just give you some sense of what that is, and the speed with which we're picking up those investments and those commitments to communities is really pretty substantial. So basic low-income housing tax credit investments, old school investment strategies that are available in communities are certainly a focus of ours. But really more importantly, we're looking and pinpointing specific communities that have need for improved access to services and access to safe and affordable housing, and making direct investments in those communities with partners who also understand that it's not just about putting units into a community, but it's about providing the supports around an individual to keep them safe and independent and flourishing and self-sufficient. And so through the work that we're doing in making private investments in communities, we're seeing really pretty substantial shifts in people's outcomes and their view of their own healthcare. We're also looking rapidly at opportunities for pay-for-success financing for those of you who are familiar with those models, but really looking at outcomes that communities, whether they're counties or cities, want to achieve, and finding ways to put those dollars in the community in order for them to improve the outcomes for an entire community, not just United Healthcare members, but an entire community. We recently entered into a pay-for-success model in Los Angeles County, and I won't get into the details of that. We can certainly, if we need to, later in the conversation. But I think the important part is our investment in that opportunity was really the glue to put the pieces together. That there are dollars available for housing subsidies, and there are dollars available for employment supports, and there are dollars available through a variety of publicly financed programs, but the reality is nobody has the dollars to put it all together. And so our commitment in Los Angeles County was really about that glue. And we're looking for more and more of those opportunities to really support our elders and disabled individuals, as well as community writ large.
Catherine, thank you. So I think you see from sort of the first few minutes that when we think about healthy aging, we need to take many things into account, whether it's social isolation, food insecurity, transportation, public policy, science and technology, housing. I think that sort of as a next set of questions for our panelists, if you could help take us and the audience through, there's phenomenal work that you all are leading. How do you scale those efforts? How can others replicate those efforts? And Patty Dale, maybe we can start with you, if you can talk a little bit more about where Humana is with the bold goal,
Sure.
your success to date, how you plan to scale it, and how others might follow your lead and example to replicate your success.
Absolutely. So first of all, the bold goal, simply stated, is that Humana will help the communities in which we live, work, and play get 20% healthier by the year 2020. And we use the measurement that the CDC has been using for years called Healthy Days. And if you're not familiar, in the last 30 days, how many days did you have a day that a physical impairment caused you not to be able to do what you want to do? Same 30 days, a mental. And across the nation, what the CDC has found for the 30 years they've been measuring this, about 8 days on average that people don't feel like doing what they wanted to do. So we're looking to improve that by 20%. And we know that we can't do that alone. So when we started our work, we went into communities, and we started in San Antonio, Texas, and we asked a very simple question: what's getting in the way of best health here? And San Antonians were quick to tell us diabetes, depression, nutritional illiteracy. But they were also quick to tell us, please do not come in and build something new, right? Communities for the last 2 decades have been very well aware that they've had issues, and they have not been sitting on their hands idle. They have been building a lot of great community capacity. What we chose to do was to step in and act as a convener, and also to bring sort of the silent party in the mix together with the community, and that was the clinician, right? Those two had not been speaking in the same room. We didn't have clinicians advising on the great local food bank in San Antonio, or the exercise opportunities at the YMCA, or the Parks and Recreation safe walking program. And so by putting those linkages together, and now we've done this in about 12 communities, we are really seeing an improvement in health in terms of Healthy Days. And we chose Healthy Days because communities understand it. Communities have been measuring it for years. And we also chose it because it's an indication of how I feel about my health, right? And if I feel good about my health, I'm more likely to step forward into health. And so we thought that was a great measure. We are seeing improvement. In fact, when we measured in San Antonio a year ago, we've seen a 9% improvement. We publish a report, a public report, because we don't believe this is just something we could keep to ourselves. If we really want to improve the health of communities, which is the only way a Humana member is going to get healthier, is if the whole community is healthier, then if we keep it to ourselves, we're doing a disservice. So we go public with this data every year.
That's great, thank you. Omar, can you talk about transportation and healthcare? So healthcare spends billions of dollars on transportation annually, and yet millions of Americans still miss appointments because of the lack of transportation. Talk about your efforts at Lyft, how you're working with payers, and then how do you scale these efforts?
Yeah, absolutely. So if you look at the entire pie of how much money is spent on transportation and healthcare, it's right around $6 billion for non-emergent medical transportation. And even with that, there's still upwards of 3.5 million missed medical appointments resulting specifically from transportation. So clearly there's still a gap. And so when we first thought through, okay, well, how can Lyft enter into the healthcare space, we looked at a lot of the regulations and realized that at the state level, Medicaid agencies already have dollars set aside for transportation. So we started working with transportation brokers throughout the US to better understand where their challenges were, really understand how Lyft can come in to help. What we realized is, one, there was a reliability factor that was very low with a lot of the transportation brokers. There was a satisfaction level that was even lower. And as a result, even those Medicaid patients that were eligible for transportation simply didn't want to take it because they didn't think the ride would show up. And so even with, that's kind of painting the picture of where that gap started to arise. And so by plugging Lyft in, again, we created this solution where, again, removing that financial and technological barrier where any of these transportation brokers or now into any of the healthcare or elder mobility partnerships can actually log in and call a Lyft through their computers, removes all of that onus, accountability, financial, et cetera, off of the patient and onto the actual coordinator of those rides. So when we looked at the Medicaid space, we realized, you know what, there's a ton more that we can do within healthcare. So then we really started to bring in, from a scalability standpoint, experts within each of the different realms of healthcare and elder mobility that we wanted to target. So from a health system standpoint, having 15 plus years in the healthcare space, I helped to build out the strategy of how to look at some of the value-based models, some of the risk models, and where transportation would really be plugged in, looking at patient throughput, the continuum of care, and how transportation can help with that. On the elder mobility side, looking at some of those senior living homes and really looking at how elder mobility and transportation can help. One piece, to Kathy's point, specifically in LA County, looking at some of those already established markets, we actually partnered with United Healthcare and AARP, where they set aside $1 million to the Keck School of Medicine at USC, specifically for patients over 65, getting them to and from the medical center to determine how the positive impact of transportation has on their outcomes, right? So really looking at not only what's going on within the industry, but then who are the partners that are not only strategically thinking through where this can go, but ultimately align with the vision that we have of really improving those patients' lives. Then really kind of expanding from that into some of the other means that really kind of are on the forefront of how transportation can help, into looking at clinical trials and even looking at more of those subspecialties like cancer treatments, where transportation becomes even more of an issue for the families along with those patients. So for example, we made a pledge for Biden's Cancer Moonshot program, and with what we've been able to accomplish in a small scale in Boston with Boston Cancer Support, we've now started to expand across the US with American Cancer Society and others to really bring dollars to those patients and families that need it. One great example of that is including ACS into Lyft's newly found Round Up and Donate program, where additional dollars can then be taken from the general population, where you're just rounding up your ride, given to ACS, so then they can reposition those dollars to ensure that those families, those patients, can start to get the care they need and not worry about the transportation. So it's really, as we think about the scalability of it, we're plugging into those institutions like Humana, like United, like the Ascensions, like, all of those ones that have very strong holes into their specific markets, and working with them to come up with the strategy as opposed to trying to create something on our own.
Omar, thank you. Mayor, Alexandria, Virginia has several distinctions. You're part of AARP's network of age-friendly communities now, and I think you've also signed the Mayor's Pledge for the best cities for successful aging.
Right.
Can you tell the audience, what's the secret of your success? What are you all doing in Alexandria, Virginia, and what advice do you have for other mayors and cities to replicate what you're doing?
Well, that's a great question. First of all, I hope all mayors will sign the pledge. And to me, it was a no-brainer. And I try every day to use the mayoral office in Alexandria as a bully pulpit for various causes, so that every day I'm pushing the football down the field, if you will, to make a difference. And I think that for our seniors who have dedicated their lives to our city, even if they just moved there, but who've dedicated their lives to our country, we should do all we can as a society to help them age and to be healthy and to enjoy it. It should be joyful. And there's so many concerns, and they lose friends, and their people are ill, and we all know these issues, but how can we make it joyful? I grew up very close to not only my grandmother, and I wear her bracelet every day, and she lived with us for a few years, and then lived down the road a bit, but I'm just very blessed, and I was very close to the elders in the family, and so for me, it's personal. And I really think public policy should be personal. And now in Alexandria, we're doing a lot of things that can be replicated. Let me just give a few examples.
That'd be great. Yeah.
For example, we just voted unanimously we have a bus system in the city of Alexandria called DASH, and we voted unanimously to have the bus rides for seniors who have a disability or any kind of accessibility issue, if you will, that it's free for them. Now, moments ago, before we came in here, I talked to the head of the DASH system, and I said, just wanted to confirm the specifics of that, but I think it should be free for all seniors. And he actually agrees. Now, is that a sacrifice? I don't know. It enables someone to lead an independent life, increases their dignity, and it should be easier. And one solution for transportation is Lyft, but if they can ride our public bus system, or if they have something called Metro Access here in the DC area, or DOT, Department of Transportation, then they get to ride it for free. Another thing that we voted unanimously for is Smart 911. Alexandria and Arlington together, and this is going across the country as well. But we just voted for it, and we've spent a lot of money on it, and it's going to make it easier as you call. You're going to get faster service. It'll save lives. There's something called a silver service card, or the silver card. Various merchants have signed up for it in Alexandria. If you show your silver card in Alexandria and you're a senior and a resident, you show this card and you get a real good discount, and so it creates community. We have a statement on inclusiveness in the city that I encourage all mayors to do some version of that, and that is that we're an accepting and embracing city regardless of race, religion, gender, sexual identity, or age or disability. You know, discrimination has no place in the city of Alexandria. You are valued and respected. And it's on a poster. That statement on inclusiveness is on a poster throughout the city. There's something called the Crunch Bunch. We have all these great community programs. The Crunch Bunch gets together regularly at one of our rec centers, and they eat together a healthy meal. They have a little bit of light exercise with some, I think, a light yoga kind of thing or something, and then they talk. It's social, and it's also enlightening. Everybody can do this. We have a friendly visitor program where volunteers visit with isolated residents, and that's social engagement. We also have something called the Snow Buddies program. This has been very successful in Alexandria. There's no reason why any city across the country can't do this. All you do is, if you're a senior, you call up and say, I'd like to be part of the Snow Buddy program, so that it's free. And so if there's a blizzard, somebody comes and digs you out, so you're not going to fall. Tons of people have signed up to be a volunteer for this. Now they're getting to know the seniors. In addition to that, I said recently to the stakeholders, you know, sometimes we have emergencies in the city that have nothing to do with snow. It could be a hurricane, a derecho, it could be, God forbid, 911, September 11th, God forbid. But it's something that happens. Somebody should call our disabled and our seniors. It's easy to do. It's easy to show that we care on a day in, day out basis. And there's so many programs that we have. It's in it. Meals on Wheels is 365 days a year in Alexandria. It's very unusual, but we can all do that. We have a nonprofit that repairs homes and addresses accessibility issues so people can age in place. I just signed us on to do this. It's a private initiative It's a private initiative has created a stroke prevention education program, and our city council declared Alexandria a stroke smart city. That is very personal to me. My mother, frankly, had some strokes, and we didn't at the time, this goes back years ago, but we didn't all know the signs. We need to teach our kids and everyone in society about the signs, early detection. So the fire department in our city offers free smoke alarm checks and battery replacement. We'll even replace the smoke alarm for free. So it's just, we want to do things that are prevention oriented. We have a falls prevention program. A dear friend of mine, a leader in the community, recently passed away. It's devastating. And it was a cascading effect from a fall. And now, anything that we can do to help our seniors with light water therapy, or it goes on and on, but we know what we can do, and food insecurity is huge. And that's why we have the meals program, the Meals on Wheels program, 365. And so I think that we can have these programs all across the country. And the U.S. Conference of Mayors, certainly, that's how I met Vivian with the Milken Institute at the U.S. Conference of Mayors, the Aging Task Force, and I was honored to be a panelist there.
Great, thank you. Frank, so you talk to CEOs and executives all the time about healthy life extension, healthy aging. What is your number one piece of advice for them to do right now as they think about the future?
The key message, which is not just business, but I'd say any leader anywhere, is to start thinking differently. The biggest challenge I face as I try to impress upon leaders that the world is changing in ways that we haven't seen before is to realize that our belief system, the things that have made us successful in the past, will fail us in the future because things are changing that rapidly and that significantly. So the key difference in the way they should act going forward is really just thinking differently about this world that's emerging, right? And applying, being open to changes to our own intuitions and belief systems because those changes are occurring anyway. So one is just really thinking differently. And the other one, I thought it was great, the CEO of Pepsi talking about purpose, because what we're starting to see is a shift from the profit motive to more of a purpose orientation, and that can only benefit society at some point, right? And so accepting the notion that purpose, not just profit, is a part of the equation. And I'll say this, we all talk about the millennial generation and how societal good is part of their kind of DNA. And that's not by accident. The internet and the connections that it created around the world has exposed them to things that when I was growing up, you just didn't have exposure to. And so the empathy level goes up as you're exposed to things like that. Now think about the world that's coming. When virtual reality, and if anybody's ever participated in a virtual experience, you would get this right away, but you're actually there. And so empathy is going to go up again because you're not just reading something or maybe seeing it online. You're actually there, you're experiencing it. And so I expect that the empathy levels will rise again. And as that happens, a purpose orientation will follow. And so you're going to see a lot of world leaders in their mission statements focus on more purpose. Profit will always be part of the equation, but purpose gets to be play a bigger role. And as that happens, I envision the acceleration of some of the things that I do talk about for the good. But as I think I was saying offline, it might have been with you, there's always unintended consequences. So the other side of this conversation is, as we advance in these areas, we have to be careful of the unintended consequences. And folks like Elon Musk and his talking about AI and what it might do to society, all those things have to be balanced. So balance is the third part of the equation.
Thank you, Frank. Catherine, there is such a dearth of supply of affordable housing in this country, particularly for older adults. Talk a little bit more, if you can, about what United Healthcare has done, how you plan to scale those efforts, and how you think others, like-minded organizations, might want to replicate that piece.
Well, I love, Frank, you teeing up profit and purpose, because it really feeds into our thinking and our ability to scale in this space. So first I'll do just really brief Insurance 101. For all of the insurance licenses that we hold in every state, we put money into reserves to make sure that we can pay any claims that come against us. That is a requirement for every insurance license, and they are hundreds of millions of dollars that sit in accounts to ensure that we can back up any claim that comes against us. The most amazing thing that I've learned over the last few years is that majority of the states actually allow us to invest those dollars. So they don't actually sit in a bank account, but we can make investments against them. And we have an amazing team of Treasury professionals who, for years and years and years and years, have been looking at those dollars and making investments on them. And those investments are low risk, very conservative, because obviously we need to make sure that the capital stays available to back up our insurance licenses. And so they were doing things like buying municipal bonds, which we still do. But what we've done over the course of the last few years, my team has made an intentional goal of educating and supporting our Treasury team to think about how to use those dollars to benefit communities. And so it's one of the quickest ways that we can scale, because we have dollars available to us that have to be put into conservative investments. And one of the best investments we can make is bringing housing units online. And so we're using the sheer magnitude of dollars that we have available to back our insurance licenses, and are intentionally looking at where are there the biggest gaps in affordable housing, and how are we going to make investments? And some of those investments will be new, brand new builds, but frankly, those are less attractive to me. Far less attractive to me and the organization, because they take so long to get online. We're actually looking at rehabbing properties and doing so in a private way, in such a way that the developers themselves want to enter into relationships with us and expand the availability of access to affordable housing. Because the terms of our investments are favorable to the developer, we're finding more and more developers who want to actually get into low-income housing. And so it's an example of how we can use what we already have there, that's required by law, will always be there, and we're marrying it to purpose. Instead of looking at it solely as an investment opportunity, we're looking at it at a wise, conservative investment that it can actually improve the care and the outcomes for a particular community. And I would say the other piece of that really gets to scalability, it doesn't make sense. First of all, every community could benefit from more affordable housing. I don't think you'd find a single community that wouldn't be the case in. Especially to rehab and improve some of the properties that are currently in the market. But we're taking some of the other technology that we have as it relates to risk stratification and identifying where the greatest opportunity is from a healthcare savings perspective and a health outcomes perspective, and layering that over communities to figure out where's the right mix of opportunity to improve outcomes with the right economic situation to make an investment in housing. So that's happening real time, and we are literally talking to developers as we're in this room, looking for new opportunities to make investments.
Thank you, Catherine. I want to get to audience Q&A, but I want to ask just one more question to the panel, if you will, and this can be a very brief answer. We are here in DC, so I have to ask a policy question, federal policy question. I am from the Bipartisan Policy Center, so I have to ask this is a bit lonely waving the bipartisan flag, but we'll save that for another time. But if we can just go down the line, and Patty Dale, again, starting with you, how can federal policymakers, whether it's Congress or the executive branch, support and complement your efforts? We talk a lot about public-private partnerships, but off the top of your mind, what's one way that you think the federal government can be more supportive to the efforts that you're leading?
Sure, I'll take food insecurity on with that. So we assumed, based on the research we'd done and the reading we'd done, that probably 15% of seniors were food insecure. We did a test and learn pilot in Broward County, Florida, with about 500 folks last year, seniors. 46%, when asked by their doctor, declared that they were food insecure. So we are now doing a year-long longitudinal study to test if we remediate, if we take away food insecurity for 12 months, can we see better clinical outcomes? If we're able to prove that, it would really be great to have food as a reimbursed benefit.
That's great. Thank you. Omar?
Yeah, and from a transportation standpoint, I mean, we're taking the same approach. So a lot of these healthcare partnerships that we have in place, we're coming up with these case studies like Care More, like hopefully we'll see with the UHC, AARP study, even with some studies that are being done in UPenn. What we're trying to promote is that including transportation, whether it's into benefits, whether it's at the federal level, private level, even at the state level, there's a tremendous impact on improving the outcomes of care. And right now there are a lot of regulations prohibiting health systems, others to pay for rides. And so what we're trying to accomplish is by bringing in even to our policy team experts that can deal with CMS and that can work at the federal level, really looking at how to bring those regulations to where we are right now with technology, with what we know from a social determinant standpoint. So there's a ton that we can do at the federal level, and even equally amounts at the state level as well.
Great, thank you. Mayor?
Well, clearly, continue funding for programs like Meals on Wheels, programs like DOT transportation for the elderly and the disabled, Social Security, Medicare, Medicaid, all of the above. These are programs that really affect millions of American families, and we know that their outcomes have a tremendous positive impact.
Great. Frank?
So I'm a big believer that the building blocks required to solve some of these great challenges are there. And so enabling innovation, the research required to continue to innovate, and agility in the regulatory process, because the speed at which some of the innovations are manifesting themselves and the scale, they scale quickly. Like you just take the driverless car or the shared services phenomena, it scales quickly. So how do we create an agile regulatory process that enables innovation to thrive as opposed to stifling innovation?
Great. Catherine?
Two interrelated, I agree with my colleagues, pay for things where it makes sense, certainly. But one of the things that I think could be done from a federal perspective is breaking down some arbitrary and misaligned policies and eligibility criteria that limit people's ability to access a full spectrum of social and healthcare services. And if we thought about them more as what we do to support an individual rather than in a program, we would have significant efficiencies and better outcomes. And the second part of that is breaking down unnecessary and really antiquated view of how to look at data between programs. There are certainly with appropriate protections for privacy, but there are unrealistic barriers that allow us, as an example, to look at housing data against healthcare data. And until we start to break down those things, we're not going to be making the right investments as a culture to supporting the needs of individuals.
Great, thank you. Let's open it up to the audience now for questions. Yes, please. Yeah, in the third row. Yep, and then we'll come back to the first row. Fourth. Yep.
Hi, thank you. Great panel. Donna Bunce, Generations United. And the question I have actually tees really well off of what Kathy was just talking about breaking down silos. And I wanted to ask each of the panelists to use sort of an intergenerational solutions lens to the area that you've been talking about, transportation, housing, whatever. But how would you look at something a little bit differently, thinking about from an intergenerational perspective? And an example I would give you is the Crunch Bunch sounds terrific. And what I do is add an element from Chinook, Kansas, where they have a school greeters program, where the older adults greet every child that comes into the public schools every Monday morning, and then they have their coffee, and then they have their exercise. So it gives them purpose, it gives them that connection. So it's taking that extra step so that we're not just thinking about aging in that silo. When it comes to social isolation, one of the things we're working with Boston University is actually marrying the reduction of student debt with supporting people aging in place to increase their ability to stay in their own homes, while a young person is then getting a benefit by a reduction in that loan debt. So it's thinking about that intergenerational solutions lens, and I'd love to hear some of your comments on that. Thank you.
Well, I love that. I'm so delighted to hear that, and every chance we can incorporate the idea of generation to generation is so important. It's important for the older adults, if you will, which I understand is the right phrase now, but it's also great for the children. And I really commend you for that comment. And we also have a program in Alexandria called Young at Art. One of our local nonprofits called Senior Services of Alexandria created, and so the elderly are painting and creating this art, and we display it. And what I'd like to do is incorporate that with the children's art, if you will, and see how we could combine some of those forces. But I love the way you think. Thank you.
Great.
And encore careers, too. The idea of encore careers is so critical. And we also have a brand new thing in Alexandria. It's fairly new. It's about a year old, called Senior Academy, where seniors can learn about how the city really works and thinking about joining a board or commission, writing letters to the editor, getting involved. I think they should consider running for office and get involved now that they have more time, if you will, even more involved than they have been. But whatever is best for them.
Great. Please. Yeah.
First of all, thank you very much. Not only is it interesting, but it's very helpful. And in a lot of the things we've been talking about really since yesterday, we've been dealing with whether it's social isolation as a cause, but loneliness really evolving to a sense of purpose, especially with the elderly. One of the things that's very important is for people to even be aware, right, that there's programs out there. I mean, that's part of the path, because, you know, not only are we dealing with the elderly, but then we're dealing with an entire group that surrounds the elderly, which is the family caregivers, which really bring it up, you know, tens of millions of people are involved in that. And I think it's wonderful to have these programs that we've talked about today. It's essential. But what is being done to make people aware that there's even programs out there that they can access? Because that's one of the steps. When you know there's something out there, you know there can be some socialization, certainly accessing people to, you know, to get them to where they need to get to. That's part of what I consider almost a window into hope, and then evolving into some type of positivity at the end with respect to purpose.
So I would start off by saying that what you're hitting on, we found in every one of the communities we went to, that there are a world of opportunities, but nobody's grabbing the ring because they're not aware of them. So when we serve this collective impact backbone role, one of the things we do is we bring some resources from corporate to teach how to put your message on social media, to teach how to market what you do to the community. And we've seen communities like San Antonio build a resource directory. And 211, the United Way has 211 in most every city, which is a wonderful, but a lot of folks don't realize that 211 is available. So making that known. So I'll go back to the point that the answer is in the room. We've just got to make the answer accessible to the people in the room.
Yeah, we've looked at partnering with caregivers, with Care Links, and even other forums like GoGo Grandparent, where they're actively speaking with elders and helping to promote the use of Lyft as an option for transportation. So kind of going back to that question around scale, it's really looking at who has solidified themselves with a reputation in the market that can help get that word out to those folks that need it.
Well, okay, I was just going to say, that is one of our big concerns in Alexandria. We have so many programs, but I talk to seniors sometimes. I said, you know, I ask them if they know about this program or that, and they don't. And a lot of people do know about it, but apparently some don't. So what they did is they came up with this, it looks like almost like a door hanger during the political season. It's just a long, narrow card, and it just lists all the programs with a contact phone number. Mm-hmm. You know, a lot of seniors are not as social media savvy. I mean, I'm pretty techie, but I think it's nice to get a card that you can sit there at breakfast and sort of look down the line and say, oh, that's interesting. And so it's literally like a door hanger, and it's just like bullet after bullet after bullet, targeting, you know, if you're interested in this, da-da-da. And I think it's fabulous, yeah.
One of the things we're doing, I think, is important to enable organizations that are serving very unique needs. If you look at community-based organizations, their mission may be very narrow, and they may have very dedicated goal of supporting, whether it's caregivers or something else. And so we've developed what we call the community data toolbox, which is actually not like 211, because you're right, 211 exists. But the problem is that community-based organizations and not-for-profits actually don't understand how to put the pieces together. They don't link what they do with the rest of the services that are available to both fill gaps as well as be as optimally effective with the dollars that they have available. And so as we're implementing the toolbox, it's a data overlay within a community, so they can actually see not only the services that are available, but then start to match data together to see, are the services actually having the outcome, the intended outcome collectively or individually as an organization, with the goal of having that data available to know where gaps need to be plugged, where we've got too much of one thing but not of another thing, to start to help communities themselves right size and find how to put the pieces together. And then our job is to direct our members to those things. and organizations like Humana and United Healthcare, that we don't want to replicate what's in a community. We're insurers, and we're mindful of that. Our job is to really start to make the connections.
So in the spirit of thinking differently, in parts of the world, these problems are so acute that it's accelerating the path of innovation. So for example, in Japan, the aging issue is acute. And so robotic caregivers are already a thing, taking care of the elderly, bathing them, et cetera, et cetera. And from the loneliness perspective, I could show you a video of Sophia, the human-like robot, and you could get to be her friend, clearly, when you communicate with this robot. And so in the context of the lonely, is a robotic solution to that on the horizon, right? And so these are all building blocks, as I said before, and it forces you to think a little differently about solving some of these problems.
Probably have one or two more. Yep, right here. Yep, go ahead.
Thank you. Good afternoon.
The microphone, right.
Thank you very much.
Thank you.
We are talking about healthy living and healthy aging. What are we doing with respect to preventing premature aging, to supporting all our people, not only our senior, with regard to bringing awareness with regard to maintaining a healthy immune system, and among our senior especially to prevent vitamin D3 deficiency, so that in the long run they are not going to be coming down with Alzheimer and dementia.
This healthy aging starts at birth, right? Who wants to?
Yeah, so at Lyft, we're looking into, that's kind of where the clinical trials section comes into play. So we're looking into partnerships with Alzheimer groups, with other subsections where we're helping to expand the participant base for those trial sites by providing more transportation to them and making sure that they're adhering to those clinical trial plans, because a lot of times in clinical trials, because of transportation, participants end up dropping out because they can't either get to the site or the site is too far away. So the way that we're approaching that is partnering with those organizations that are conducting those clinical trials that will then end up helping the longevity of those folks by finding those cures and able to then pass those on to the broader population.
But what I'm talking about not enhancing the longevity. What I'm talking about is supporting our different populations in our country to stay healthy. Recently, I did a study on Alzheimer. I don't want anybody to get Alzheimer. I think Alzheimer, just like cancer, 95% is preventable. Only 5% is to genetic abnormalities. So what are we doing in terms of prevention?
Sure.
Preventing diseases so people, they don't get to this stage that we are going to help them to get Alzheimer care.
Sure, and I think that goes very well with kind of, having two of the larger insurances here on the stage, is looking at preventative care and really looking at the regulations that are currently out there from a federal standpoint that are preventing a lot of these innovative ideas from being put into place to allow those patients to have access to preventative care and access to transportation specifically to be at a point where we can start to catch things ahead of time as opposed to not.
I honestly think there are two keys from an insurer's perspective. It's absolutely in our interest to helping people stay healthy. That is absolutely in our interest to doing so. I would say there are two things that are in our toolbox today that are still have not come close to getting the right level of outcomes that we should see. One is around personal engagement, individual engagement and education. What are we doing to support individual members to understand how to be healthy, to overcome things that are within their control, frankly? We still have too many folks who are smoking and using tobacco. We still have too many people who are overweight that need to have their weight managed. That, to us, is putting rewards in an individual consumer's pocket in a way that actually makes them change behavior. And there's a lot of work that's done there, but I think we're barely scratching the surface, quite frankly, in how we engage individuals in their own health. And then the counter of that is, how do we engage providers who are providing services to those individuals? And how do we create financial incentives through pay-for-success models or pay-for-performance models to help them encourage healthy lifestyles and to do preventive medicine in such a way that we're really making an impact? I mean, the reality is oftentimes we get sucked into the 1.5% or 2% of the individuals who are costing inordinate amount of money to the healthcare system, and we need to support them. We absolutely need to support them, but it's the 98% that we need to be watching as well, and that's where the right balance and the right relationship with the providers and the individual themselves are really going to be key to overcoming or slowing down, in some instances, some of these health concerns and chronic conditions.
It's a very important point, but thank you for raising it. Healthy aging can't start at 65, which is, I think,
Right.
the important point. It
Right.
has to start
Right.
earlier, and social determinants of health, the behavior change that we need has to start much earlier. So it's an excellent point. Very last question. I know speakers will hopefully be around, so you can ask additional questions. Please, go ahead.
I'd just like to hear a little bit more about some volunteer activities. My mother-in-law left yesterday for a 2-week trip to Patagonia. In February, she will turn 90. I think one of the reasons that she is so healthy and is aging is she's had real meaning in her life. At the age of 80, she was in Fallbrook, California, a volunteer deputy sheriff of the sheriff's department. And they went out and either visited elderly in their homes and literally in a police car would go and visit them and check on how people were and fire situations and so on, or call them from the police station. It was called a You Are Not Alone program, and call them a couple times a week. That was so meaningful to her and obviously to the people she was benefiting. And I'm just wondering whether there are other examples like that that really contribute to meaning in the lives of the elderly.
In our work for social isolation and loneliness, we have developed what we call a loneliness toolkit. And we've actually built a predictive model that if certain life events happen, that triggers, you're probably on the pathway. And so we offer this loneliness toolkit, and a part of it is around volunteerism, is around purpose, is around optimism. Optimism has a huge, your mother-in-law probably just bought a bunch of brand new towels because she thinks she'll never wear them out, right? I mean, optimism is a beautiful thing to prevent aging as well. So we do take that into consideration, the volunteer and the purpose.
And let me just say, to add to that, I think that was a perfect answer. I know in Alexandria, just to mention these two really robust nonprofits, Senior Services of Alexandria and At Home in Alexandria, it's so social. It's just unbelievable. You want to get involved. You want to participate. You want to help others. If you're thinking about others, they know that there's a happy quotient that goes up. And a lot of At Home in Alexandria provides transportation. Like they'll volunteer. So let's say they're 70, 75 years old, but they're still driving. They'll volunteer to take someone to the doctor, and they'll stay with you. But it's also social. It creates community. And my purpose as the mayor is, what can we do at City Hall to help people create community and make it a happier place? I think that it's joyful to find these things. And I think any city, any community can create this senior advocacy roundtable that I did. It's just get everyone at the table, every stakeholder. The local hospital was there, the local place. It's a large building where the elderly go. It's called Goodwin House. I'm not sure. Senior Care Center. These nonprofits I just mentioned were at the table. The city, the Commission on Aging. Every city should have a robust Commission on Aging so that their elected leadership can hear directly about the needs of the seniors. And the Commission on Aging can engage more volunteers. But the leaders of each city, in my opinion, and the state and at the highest levels of government should be saying how valuable our seniors are in the country, and should be saying that we need your help. We need your help as a volunteer. We need your help in the campaigns that we run for office. We need your help on the school board, and it goes on and on. And so I don't know where we would be in Alexandria without our seniors. So we're really blessed, and they need to know that we're blessed because they're there, and we want them at the table.
Well, on that note, I want to thank all the panels. Thank you for your leadership, your expertise, your time. I want to thank everyone in the audience for your interest and insights as well. Thank you to the Milken Institute. Thank you.
Thank you.